So, hi everyone. We're going to have a conversation about vaginal health. The title of this kitchen table is Leave Your Vagina Alone. And I want to explain kind of why I decided to have this topic. One, because it's the summer, and I know people will be doing a lot of like exercise, sports, swimming, a lot of things like that. But what I've noticed a lot through my work in seeing patients is that bacteria vaginosis or yeast, they tend to rise during this time. And I noticed that some people, when they have one situation, it continues to bother them pretty much with the whole summer. Some women even suffer up to a year with this. And what I found is sometimes it happens, there's no explanation or we can't find out a reason. Sometimes there is a reason. Things that I've seen, one is that certain soaps that people use, certain body products, when Victoria's Secret came out with their line of beauty products and different scents, that also caused a lot of issues, especially with yeast infections. But I found that people do a lot of things to their bodies. And I want to ask to see if you heard of any of these things, but from apple cider vinegar douches to douching with just water or baking soda. Boric acid is a new thing that I have issues with, even though I know that there are some healthcare providers that recommend that to women. I think it's just a quick fix, but also my experience, I use boric acid to help with ants. I see them the first of the season, I sprinkle them around the house, outside, and then I don't see them the rest of the season. So I always look at it as something that is very toxic, but I do know that people are even on TikTok, saying that is a good product or selling them on Amazon. I've seen that too, that I can't believe. But I just feel like there's so much that we do to our bodies that make things worse when our body can naturally be able to handle some of the things that happen. Not to say you don't have to. Somebody was like, I love honey pot. Please don't tell me I have to stop using honey pot. If you find something that helps you, you're welcome to use it, but just keep in mind that your body does what it needs to do. But I do want to hear from all of you, what are things that you heard people do and what were explanations that they said as to why they would use certain things? If you heard anything. With boric acid, people use that to treat bacteria vaginosis, which is like a kind of an overgrowth of bacteria that's already normally in the vagina, but it can cause like odor. That's really the main complaint that people have. They'll complain of a fishy odor and they'll say, no matter what I do, I shower, I bathe, it doesn't go away. And I also just want to say that vaginal infections don't have to do with hygiene 100%, because people think that it means is a sign that your body is not clean. It's just something, and I'll talk about the causes of those, but it's something that just happens, that something could throw the environment in your vagina off, and that can cause bacteria or yeast to grow. And this is not sexually transmitted, but I'll talk about some of the causes later, but I just want to say that that's what it's used for. And also too, I know that there are companies that are making it, and there's a certain amount that they use. So it's important to look at that, and also what it does to the body when it's used. So that's really the best indicator if it's helping you or not. If every time you're using boric acid and you stop and then the infection is there, it's just also saying that the boric acid is covering it up. So, and I just also want to say that this is not to say, I'm not going to tell you what to do with your body, but just think about what you're using. And because people do say they notice the odor goes away, they feel better, but then at a certain period of time, it comes back. So it's like, and again, we're still trying to understand how it helps the body. And we're also trying to look at that long-term impact of it, because we know what it does for you now, but what does it do for you 5-6 years down the line? Okay. Anything else about things that you've heard people use? That's the other piece too, is that quick fix. And the yoni steam, that is more, again, it depends on, like you said, what herbs you use. That is a more natural thing to do, and it's supposed to cleanse and purify. and it still is just using steam. So it's not using something that's aggressive either that you're putting inside. So again, I don't know the long-term impacts, and I know people do it more too as prevention, because once they have bacterial vaginosis, I'm not sure how effective it is, or if they have yeast, how effective it is, but it does, some people said it just makes them feel better. They don't know if it's helping, but they feel better. And anything that makes you feel good, I think is good. Anyway, so there's still a lot out about that, but that, like you said, it does depend on where people are getting their herbs from. And I have recommended to people who, especially if they like lavender, for example, there's certain things they could grow them themselves, because that way they know where they're coming from. And lavender is very easy to grow, and that's just one of them, but there's several other herbs that are very easy to grow and are very hardy plants. But then you know where it's coming from, but definitely being careful with that. Okay. Anything else? Because I just want to talk about some of the things that they say contribute to bacterial vaginosis. But I also, even before I get into that, how the body kind of knows how to help you to fight certain things, that sometimes there's something that, that you're like, if you go swimming and you're swimming in chlorine, or even the sea, because we know, especially got Connecticut beaches, and I don't want to try to down Connecticut beaches, but we know sometimes that water is not the freshest, but sometimes your body can adjust and change and help you to, if there is a bacteria or something you come in contact with, try to help your body to regulate it. And it does that on its own. It's just like your body goes through changes. And I always say that vaginal discharge tells a lot about your health. A lot of times we don't notice or we don't pay attention until something is going on, but it does tell a lot about what's happening to us. And so, anyways, it'll go through changes through the month, like, during ovulation, you have a clearer discharge. After the period, it could be a little heavier, a little thicker, but again, it's your body's way of kind of cleaning and just trying to regulate the hormonal changes that it's going through. And then when there's something that disrupts that, then that's when we start to see vaginal things, bacteria and other things grow. And with bacterial vaginosis, for example, we know that, and this is just through research, through drinking lots of caffeine, tobacco use, those are some of the main things that can throw off the pH. And we kind of know that certain things, even alcohol, we know if somebody especially has too much, we know we can smell it through their pores. So we can just imagine like what it's doing to the vagina. So, but tobacco use, caffeine, again, harsh soaps, those are things, certain medications, those are things that we don't talk about. And one area that they're looking at, but they're trying to get more information about, is stress. They're saying stress has an impact, and we know it changes our bodies and how we even fight infection or things like that. So those are just some of the common things. When we're looking at yeast, yeast loves heat and moisture. So somebody who's like working out regularly and they're sweating in their clothes, again, certain items that they use, but also yeast, if someone's taking antibiotics, we know, especially penicillin. So even when I have a woman that I'm treating for a UTI, a urinary tract infection, I will give her, as if she says she's prone to yeast, I'll give her like a tablet or something that will help with it, or I give her a cream if that's her preference, to have just in case. Because it's so common, especially with penicillin. Not all antibiotics do it, but that's usually the number one thing, especially if someone's taking it for more than 3 days. So if you're on it for a week, I had a patient who had, I don't think it was Lyme disease, and she had to take antibiotics for a long period of time and just had an awful yeast infection. The other thing is, if there's a medical condition like diabetes, even HIV, because those both change the body and the immune system. And so I've seen women who had like awful yeast infections, and then they were tested and they had diabetes. That's the most common thing that I've seen. I even had someone who came in to see me, and her skin was just, because yeast is aggressive. It's really not something that can cause you death or cause serious harm, but it can really break down and tear down the skin. And when I examined her, I asked right away, do you have diabetes? And she did. And it turned out she didn't see her provider for a long time. But she was like, how did you know? And I was like, I can see that how your skin is broken down. And because of being able to see that, I was able to encourage her to go back to see her provider. But that's also something else. And I just share those ways that can cause it, and especially medical conditions, because the other thing is with bacteria vaginosis too, I've seen people who had chlamydia infections or gonorrhea infections, and they weren't having any other symptoms except symptoms of bacteria vaginosis. And then when they were tested, that, it came back. So it was like they, like sometimes there's something else that's there. So I always get a little worried when people do self-treat also, because if there's a chlamydia infection and then you say, well, I'm just going to go and get Monistat, get something over the counter, but then you have something else underlying. But also if you have diabetes and then you just keep self-treating yourself, that also could be, worrisome too. So those are just, that's why I always say it's important that if you do notice something, you should see a healthcare provider. There's women that they learn their body, they know right away. And I trust them because they know their body. So if they're like, I had bacterial vaginosis before, I did whatever, and then now it's there. Can you give me something to treat? To treat it, I may not have them come in as long as there are symptoms and they're not worried about anything else. But I also say, if you take this and it doesn't help, then I would like you to come back so that they'll come in so I could evaluate you, just to make sure there's nothing else going on. Okay, any like questions or comments about that? What you're saying is so important, because we didn't really learn, we didn't really learn about what's normal as far as our body sometimes, especially even vaginal discharge. Like some people never knew that it was normal. So when they have it, and I do have people who come in who they have, they'll say, I notice this white discharge. I think something is wrong. And I check their discharge and there's nothing, it's normal. There's no odor, it's not itching them, but they just see it. And they're like, I keep seeing it in my underwear. Or the thing I hear a lot is, I notice it after my period. Something wrong, but it's a normal discharge. But it's because we don't talk about it. And that's the reason too that I'm having this discussion, because we don't talk about what's already normal with our bodies. And we don't talk about what we can do to protect it. Even for myself, I didn't learn about dishing till I was like, and I hope my mother doesn't watch this, but I was like snooping around her room and I found these boxes under the bed. And I was like, what's this? And I looked them up and found out what they were. But I know that was something too that was in her family, because I don't want to say all Black families do this, but in her family it was passed down that that's something that you do to clean yourself, and you do it once a month after your period. But that's all I knew. I didn't know anything else. And I couldn't even ask my mother. If I would have asked my mother, what is this? I would have been in trouble, first of all, for looking around, but I didn't know how to even ask a question. And my mother wasn't the type that would talk to me about these things. And I know later I learned that it's her own discomfort. But just to go back to what you're saying, there's so much that we don't know that's even normal, but also how we care for ourselves. And diet is a huge thing too when it comes to vaginal health. There's women that I talk to, and when I look at their diet, and they're just basic things like drinking water. There's some people who don't drink water at all. And I do see a higher, and again, I don't have the actual statistics on this. I'm just going by the patients that I see, because too, when they come in for care, and this goes back to what you said, Lindsay, they want a quick fix. They want, tell me what's wrong, tell me what's happening, give me a pill, and then I'll be on my way. So when I start asking them about body products or what they've been eating, I ask them about, do they have, like, for example, yogurt? They say yogurt is something that can help. Would they say, probiotics can help? So anyways, I start asking those questions. And then I find women who have a lot of sugar in their diets. They have no water. I have someone who wasn't drinking water at all. She was like, I just drink Coke, and that's it. She was honest about it. And I said, can you just do me a favor? And I don't want to tell you, because she was looking at me crazy. I was like, I don't want to tell you to stop the Coke, drinking the Coke, but can you just add a glass of water each time you have it, or in between? Can you try to make water more of what you're drinking instead of the Coke? And she did try it. And she was someone who had issues with yeast. She wasn't diabetic because we were worried about that, but she did have high sugar in her diet. So not only the soda, she said she did not only just chocolate. She said, I just crave it. And it turned out, again, just talking with her, it was stress. It was comforting her. So it was like the Coke was getting her going, getting her started in the morning, and the sugar was feeding her. She's like, I'm anxious. I'm not even hungry. And I want to have a cupcake or I want something sweet. But anyways, when I start to talk about their diet, I'm like, you have to be a detective because I can't give you the magic answer, but I can tell you what some of the main things are. But people don't even associate their vagina with what's happening outside, of their vagina. And I think that's the piece that we often miss. But we also don't realize that we get a lot of messages, and this is my own experience, even in nursing school and anatomy and physiology, the professor said the vagina is a dirty place. There's a lot of bacteria in there. And I'm looking around like, did she just say that about, like, I'm looking around, everybody else is just taking notes. So I was like, something is wrong with that. That doesn't make sense to me. But that's what we were taught. So if that's all the messages that we're getting, then we look at it as a dirty place and we have to do what we can to clean it. And sometimes we overdo that. And I'm gonna call on you as a nutritionist. What do you see as far as the diet is concerned with vaginal health? Yeah, that's you're saying that. I'm thinking in nursing school, other than anatomy and physiology, that was all that we were told. In midwifery school, we learned about bacterial vaginosis, but we learned how to test for it. We didn't really learn how to prevent it. We didn't even learn, I had to do my own research and how to talk to patients about it, because all I knew was you come in, I look under the microscope, let me give you a medication and send you on your way. But then I started seeing people coming back over and over saying that it went away for like a week and now it's back. And that's why I had to start to try to learn more, because antibiotics is a quick fix. But if there's something that you do have a lot of soda, you have a lot of sweets in your diet, you're not changing that, then it's going to keep coming back. And it's like once people get diagnosed with it, I think they're more aware also. Because I do feel like, especially in the beginning, your body tries to balance things out itself, is that when it can't, that's when the symptoms can start to get worse. Yeah, anyone, I noticed some other people came in. Do you want to say anything? Yeah, because I noticed, and I just thought of this, is that so many people also don't have enough vegetables in their diets at all. And that was shocking, especially young, Lene, you talked about young people. A lot of young people don't even know. And it's or they don't know the benefits of it. Because a lot of times too, I guess we're looking for quick meals and fast meals or something that's easy to make. And but that was something that was alarming to me, lack of water and also just lack of vegetables. Fruits were easier. I saw more fruits than vegetables, but some people may have like one serving of vegetables a day, and that's it. There was someone that I asked them about vegetables, and they told me, yeah, when I have my sandwich, I put a slice, I put a lettuce on top. I was like, that's good, but you need just a little bit more. But that was surprising to me. But I do notice, and I'm going to do a special kitchen table on menopause, because that's another area we don't talk a lot about. But even I had someone who was having hot flashes. And again, no water in her diet, just drinking more water. And she did increase her vegetables. She said she felt so much better. It was like night and day. But it's just like we can't underestimate that power of nutrition. Yes. And I was one of those children told you couldn't get up unless you were finished. And I remember trying to hide food around the rim of my plate, not realizing somebody's going to pick it up. But I do realize that. And sometimes even now I'm sitting down and I'm like, you got to finish your food, and not realizing just take it home and save it for later, or these are leftovers for later. But you're right, there is that disconnect. And it's when, and I think that sometimes we ignore what we're doing. We don't pay attention to signals. Like if someone uses a certain body product and it makes them feel uncomfortable, sometimes it takes some time to realize that something is going on instead of right away saying, this doesn't feel right, and maybe I should stop using it. So I think I think there is that disconnect, that everything ties in together. Because if something's happening with your vagina, that's going to impact your mental health too. It will. So I think that we just have to realize that anything that we're doing to our body impacts every area of our body. And I think that we have to keep note of that. That's an important piece too, because our body does go through changes. And we don't talk about menopause at all, especially in the Black community. We don't talk about it at all. But as we do age, our body does change. And even the way that our bodies respond to certain things, like I'm just thinking of someone that I saw that had a yeast infection. She didn't even have yeast, she had just more irritation. But she was like, I always use that soap. I don't know why it's bothering me now. And I did talk to her that your body changes when you get older. But I also let her know too that companies change the way that they produce things. So it's very important for us to keep an eye on what we're using on our bodies. And I do want to take a moment to talk about that. But aging is a big piece. And the other thing is that aging, it is a natural process. A lot of times when we look at things related to the vagina, it always has to be something bad. It can't be that this is natural and this is what we're going through. Even sometimes our emotions that we feel, we're not supposed to feel anything. We're just supposed to exist. Men can feel a certain way, but we can't. And so, we even have to look at that. But as we're getting older, and I do want to touch on this because it's an important thing, is that sometimes, for example, there is a decrease in vaginal lubrication, and it could make sex very uncomfortable for women. And it starts with perimenopause, and it starts with, especially when they become menopausal. But sometimes they'll choose products that are not safe to use on the body, even though they're geared towards women. It'll say vaginal lubrication, talk about pleasure and all these things. I don't even know if they still sell this, but there was a lubricant that heated up when women had sex. And I was like, who wants that? But still it had a lot of chemicals in it. And women did react from it because there's also chemical vaginitis. So some of the products that people use can cause harm and break down their skin. So I just want to say on that, there are lubricants that are water-based. Anything that has a bunch of chemicals should not be going in the body at all. If you want to try certain things and use small amounts of it, but really look for things that are water-based. And I just also want to say, not every female who ages goes through problems with vaginal dryness either. So not every woman will experience that. They'll still have lubrication, maybe not as much as they did when they were younger, but they will still have it on their own. Because sometimes when I'm in spaces and I talk about this, people are like, I don't want to get old, but it's gonna happen to us either way. But there's ways that we can still, care for our vaginas and keep them healthy without causing harm to them and still have pleasurable sex lives too. So I'm just glad that you mentioned that, because that's another whole piece of this. And that made people believe that bacteria vaginosis was sexually transmitted, and it's not sexually transmitted. They say, so because with bacteria vaginosis, it can happen even if you're not sexually active or if you're not having sex with men, penile sex, you can still get bacteria vaginosis. There's another thing that's in play, and one is the body products that your partner uses. It doesn't mean that they're dirty, because I had someone and she was like, I got a new partner, he's dirty. And I'm like, it doesn't mean that. And she didn't have any sexually transmitted diseases. She just developed bacteria vaginosis. But so they can respond to their body, whether their partner is circumcised or not. Circumcision is supposed to be known to have more bacteria and more difficult to clean, but it all depends on the person. But still, someone else who uses, sometimes, guys, they want to be extra clean too. So they use certain body products that can be harsh and have harsh chemicals. Products for men are a little stronger, because you'll even see some of their cologne or even body wash for men. Sometimes it has a very strong smell. So that's one piece of it. The other piece is how their body reacts to semen. And semen also can change in its composition so that it can have, if they smoke marijuana, and I'm just using that as an example, if they have poor diets, there's other ways too that can make their semen kind of change so that it can cause a chemical reaction in the female. It doesn't mean they have a sexually transmitted disease. I do always recommend still that if they have a new partner to test for it. And but sometimes I've seen women have frequent infections and they want to treat the provider wants to treat the partner too. I don't think that helps. I've seen people do it. I don't do that because I think that the partner can look at, again, their body products and different things and the way they're eating too. But I just want to make sure people know that it's not sexually transmitted, that it can happen whether or not you're sexually active. It's just that, again, it's those chemical reactions. Yes, that it can be that way too. So that's why it's so complex. It's not so clean cut in how to even prevent it altogether. But it's just to think about those things when you have a partner, and if you have a partner that cares, I shouldn't even say that. If you have a partner that doesn't want you to have bacterial vaginosis or problems, they'll get tested. They'll look at themselves too and see what it is they're eating. They'll see what they're using on their bodies. And just wanted to also say, even with condom use, for women, it's like we can't win because everything is coming at us. So certain condoms you could react to. And sometimes it's about finding the one that is safe for you. I always say, like with latex condoms, there is allergic reaction, and it can almost mimic yeast infection. But when they come in, it's like they're reacting to the latex. So they have to check, and there's condoms that are not made of latex that they can find. But I also tell women to also be careful of what's lubricant is used with the condoms, because that's another thing as well that women can react to. So I think that especially if you're worried about infection, you're trying to protect yourself, you have to use condoms, but there are types that will work for your body. And I always tell women, not even just to wait for symptoms, if you use a product and you don't feel comfortable, then you don't want to use it again. And I recently had a situation with someone who used a bath bomb, and they said it smelled good, it felt good, but they like the moment that I got out of the bathtub, I knew that something was wrong. And this person ended up having a very severe yeast infection. But still, we can't say 100% if it was the bath bomb because she noticed it after, but it was very quick in timing that she noticed it. So anyways, I told her to kind of think about it, but she's no longer even going to use that because she didn't like how it felt. Yeah, that's a tough one. And even there was someone who she wasn't going to be able to come today. And she said, I love using my honey pot. I'm not going to stop using it. So Honey Pot is a Black-owned company. Someone may have bought her over, but I know that she was a Black woman who created it. And all her products are natural products. She does infuse like lavender, and it goes from a body wash to even tampons, pads. There's a whole collection that she has. And I also want to say, if there's something that you're using and is not causing you a problem, then you could continue to use it. For myself, I'm a bubble bath person, and I love, I found a product that I can use and I feel comfortable in. And sometimes after a stressful week, I love my son is away, I love to have my bubble bath time, but I don't have any problems with it. But with Honey Pot, I think that some of her products have been tested. Some of her products do have chemicals in it. So I think to be careful of that, because if you say something has lavender, then I just want to see lavender on the ingredients. And for pads and tampons, they do list the ingredients. And that's also another culprit too, I want to mention. Some of those pads that are super absorbent, think about the chemicals that they put in it to make them super absorbent, especially tampons. So always look at the box to see what is inside of it. So, because there are some that are not harmful. So Honey Pot, I would say look at the ingredients in the product that you want to use. If you haven't had any issues, that's okay. But if you do notice yeast or bacteria vaginosis, that's something that you would have to look at as a possible culprit in it. Because I believe, like, I know that some of her tampons, for example, are unscented and they don't have those extra chemicals in it. But lavender and those other things, because sometimes lavender is not pure lavender. So I'm just gonna say, because I don't want to knock a company, I just want to say, look and see what you feel comfortable using. But it's supposed to be hypoallergenic. It's supposed to be organic. And we do know people like to put those labels on certain tampons and pads, and they're really not. So just do your own research in it and see, again, how does your body feel when you use it? And the wash is only external. That's the other piece I want to say. And external products are okay. Anything that you're using inside or you're using excessively, that's when it could become a problem. Yeah, and tampons, I want to say are okay. I always tell people, because tampons are expensive. And so sometimes, and this is just someone that I spoke to, she would leave her tampon in longer because she didn't want to change it. Because anytime you go to the bathroom, you should change it. After 2 hours, and again, people can use them up to 4. I say after 2 hours, you have to consider changing it. This person was using it beyond that because, again, she was to save money. She loved tampons. She didn't like pads. She loved those. So if you're going to use tampons, just try not to keep them for as long periods of time. And when you do go to the bathroom, just keep in mind that urine can touch that string, the string, or the way that if you clean from back to front, that you can contaminate the tampon. So it really should be removed when you go in there, anytime that you go to the bathroom. And I just shared it because sometimes people don't want to, because they may have just put it in and they realize they got to go to the bathroom an hour later. If you're going to the bathroom, you have to take it out and clean it. So it's just really the frequency, because for a lot of people, like if you do sports, other activity, if you're a swimmer, it's like you have to learn to use them. But even if you're in the pool, you got to take that out and change it. You can't leave it in for long periods, because you're letting those chemicals stay in your body. So, and that could be a medium for bacteria to grow. So tampons, there's nothing wrong. Again, cotton, be careful of what's inside of them. And you'll be surprised what chemicals, just even the next time you're in Target or Walmart, look at what's in some of those products. You'll be like, what? Because you wouldn't even give those products probably to your worst enemy, but they want us to use them in our bodies. So any other questions or any comments? Yeah, there's different herbs that make up the what's used for the steaming. And I was just saying how they just have to be natural products, that they have to be, and I was just mentioning how you can grow those yourself, but again, still just be careful that other things are not added in. Most people who do it, especially do it professionally, they're trained, and so they know what to use, but some people can do it in their home. And again, it's also something that you're not inserting into your body. It's just the steam from it. And that is not harmful. But again, it's what chemicals are being used. That's like a very old African tradition. And there's a lot of things in our history that were natural and safe for us that are coming back. And that's one of those things. Yes. Any questions or any comments? Okay, so just also with latex allergy can be a serious allergy. And when so you have that reaction that first time or second time, it could be mild and it could start to become more aggressive. So when you come in for any appointment, make sure they put it in your chart that there's a latex sensitivity, because we try to avoid using latex gloves, but some practices still use them. And you could have a serious reaction from that. And when there's an allergic reaction, the regular, because sometimes it can mimic signs of yeast. So we think to get a yeast treatment for it, that may not help. What really can help sometimes is Benadryl or something to treat the allergy. But the most important thing is making sure that they know before there's any examination. Okay, does that answer your question? Yes, because there's more, again, it's almost as if you took a medication and you had a reaction to it. It's like somebody breaks out in hives. You don't want to just give them an ointment to treat the hives. You need to give them something to help with the allergic reaction. And there was something that you said, because I've seen with latex allergy, it's often underestimated. I've seen people have blisters, redness, swelling. Someone, and I can't even get this image out of my head, someone who had sex using latex condoms had awful reaction from it. So the more that you're exposed, the more the next time it could be worse. And it is very uncomfortable, very uncomfortable. And I've had people who thought it was yeast and they took something and it didn't go away. And it turned out they were allergic to latex because the next time they used, whether it was latex gloves or they used latex condoms, they had that next reaction. So it could be very serious. So that's why I always just say, we take that, where I work, we take it very serious. We even ask specifically if there's a latex allergy, and that goes in your chart. Even in hospital rooms, you'll see if someone has a latex allergy, they'll put it on the door because they don't want anyone coming in at all because it could cause a serious, serious reaction. I think because the vagina absorbs things differently. And that's why sometimes there's a different reaction, not just from latex, from anything. It's almost like certain people use, for example, certain soaps, and on their bodies, they're under their arms, their other skin can handle it. But when they use it in that area, they can have a reaction from it. Because the vaginal, the way that just the makeup, the cells are, as you know, the cells are more absorbent, thinner, they could break down easier. So that's why sometimes reactions could be different in that area as well. So just a couple things, and then we're gonna just wrap up. And again, these are only recommendations. And I just tell people, if something is going on with your body, and today I know our focus was on, vaginal health, but I always say if there's something going on with your body, to make sure that, because a lot of times we think things will go away or get better, but sometimes it's better to get medical advice. And when you go in, sometimes when we go in for our visit and we have concerns, sometimes the way our providers come in, and it's not always their fault, it's more the system that they're in and out, to make sure that you have questions ready and prepared so that, they'll do the exam, they'll think that they're asking you things, and then they'll like, do you have any questions? And sometimes you could be overwhelmed by what happened during the visit that you forget to ask your question. So just try to have it prepared. And what I even told people to start doing is, even before their exam, say, I have this concern, could you check it for me? Is this all right? Or this, after my exam, can we talk about this? So that they can even start thinking about it or be able to give you some medical advice regarding it. But I just feel that we have to also just make sure that if there's something going on with our bodies, we're the best people who know. And also, if you're seeing someone, you're like, oh, that's fine, that's normal, get a little more elaboration, especially if it's something that's making you uncomfortable. And they should always provide information about prevention. So just keep that in mind too. Oh, okay. And there's just a comment that it's okay to let the vulva breathe. Wearing cotton underwear are best, but it's nothing like letting some air flow down there. Okay. Oh my God, I'm glad you said that, because that's something I wanted to mention as well, is that we have to make sure that we treat our vaginas good, that we take care of our vaginas. And sometimes, especially if we are working out, sometimes even during the summer, we have to go in wearing a uniform, or we can't wear shorts or, wear light clothing. And sometimes we could sweat in our clothes, or our bodies, our vaginas can't breathe. So even I recommend, even if you are sleeping, and as long as you're comfortable, that to let your body breathe. If you're home, and you're just relaxing, just put on a skirt or a dress and not have any underwear on. And I know that there are some very beautiful, sexy underwear out, but you do need that cotton for your body to feel comfortable and breathe. So even if you are going out, let's say you have a special event, to not to be in the same underwear for a long period of time, especially if it causes discomfort or irritation, to try to change it as much as you can. And there's nothing like some nice cotton underwear that are really good as well. But thank you for saying that, just to give your body a little TLC. And sometimes that's what's needed. You don't need any lotions down there. You don't need any Vaseline. I've had someone who used Desitin, baby oil, baby powder. Your vagina doesn't need all those things. It's going to take care of itself. So, any other advice that anyone has about, someone said coconut oil. Yes, coconut oil is good. Pure coconut oil. I just also want to add that, because I had someone who used a cocoa. Well, there was a cocoa, was it cocoa butter? I don't know, can't remember. It was cocoa butter or coconut oil, but something else was mixed in it. So this is pure coconut oil. Without underwear. The other thing is sometimes just drying your skin, just going to the bathroom and then just drying that area. Because there's this normal discharge, but also there's creases that we could also sweat in. And the other thing is to not be aggressive either with drying or cleaning, because that's sometimes just the friction of it. But if you are, again, it's just taking breaks, going in the bathroom, because it's and to just dry. And I did have someone who tried to do this on their period. So I'm just saying, on your period, have a tampon or something in. She didn't realize that, I was telling her to when I told her about having her vagina breathe, she was on her period and she decided to not wear underwear. So that's something that changed. That's something that's different, where you have to have something there to, of course, to collect, whether it's a tampon or something that's there. But just for someone who's especially just walking around their house, you could even go outside. I'm not saying that you can't, because if you're in the store, nobody really knows. But again, if you go to the bathroom before you go, make sure your skin is dry. Or make sure that you can go to an area. If you do feel discomfort or something like that, you can do that as well. See if you're in chlorine water. If you're even in the ocean, again, to get out of them as soon as possible. And that's the same too with the gym. If you're in the gym and you're sweating, I know some people don't like to use showers or even change there. But I say, even if you don't want to take a shower, put on some dry underwear and dry pants. And that should, just to get out of the wet clothes right away. Because I see that a lot with athletes too, that they're working out every day and sweating in their clothes and not changing their clothes right away. So that's important. And it's not even so much about showering after, it's about being dry and your skin being dry there. Because that's the other, especially with yeast. Yeast loves moisture. Yeast loves the summertime because it uses moisture to grow, moisture and heat. So it loves this time of year. But and it doesn't even always have to be yeast that's developing, it's just that moisture does cause that discomfort. Yeah, so, and that's a time when a lot of products are introduced, whether it's tampons or pads. So I always say to go first, definitely have things that are more natural, but what works with your body. And I've had people who've had reactions to pads that you could even see it along the line where the pad sits. You can see how their skin could be discolored or they have some irritation. So it's important that you don't have to be stuck with whatever pad you use, you have to try to find one that works really well and agrees with your body. And again, the less chemicals, the better. And the same that I say with tampons, again, is every time you go to the bathroom, try to change your pad if you can, to put in something fresh, because think of that moisture that's still there. Sometimes people think that their body is dirty, like the blood, they think that the blood is dirty, their body is dirty, and it is your body's way of kind of cleaning itself, cleaning out the uterus, the lining is slugging off, but it doesn't mean you have to be aggressive in how you clean your body. I do want to say, when I was younger, I was told that you couldn't take baths on your period. I don't know if anybody else heard that. And I asked why, and my mom was like, "Oh, it's not good. You know, you're not supposed to do that." But later I found out that it was okay, because your blood flow does stop. And the other thing is that the blood during menstruation can be a source of bacteria that holds bacteria. Bacteria can grow. So it's important for people that when they do change their pads, that they make sure that they clean, that there's no like blood sitting there, that they adequately clean themselves. And it's okay to take, whether it's a bath or a shower, whatever their preference is. Still not a lot of soap in the area, still not aggressive with cleaning, because your body still knows what to do. But always just make sure that you clean and dry yourself as best that you can. And there's really, because like some people want to look for a number of hours to change, but I would say to let people make that decision, but just not to do it for long periods. And it's okay to have sex during your period. It all goes by comfort level. There's some people who wait for it to be lighter. There's some people who don't care. And sometimes for some women around their period, their sex drive kind of increases during that time. And I don't know if there's different theories as to why. It's just our hormones, or people say that because they know that they can't or get pregnant, even though there's still some people who say that they got pregnant on their period, because it really all depends about ovulation. But it's really up to the woman and what she feels comfortable, and her partner, what they feel comfortable doing. But there's nothing that's going to cause harm to their body. They're not going to get bacterial vaginosis or yeast just from having sex. It's not unclean to have sex during your period. So again, I always leave it up to the person and their comfort level with that. I think the main thing is the products that they use, and if they're safe, and if they cause any discomfort to them at all. So if you use a pad and you feel itchy or uncomfortable, then that's not the right pad for you. And again, be careful of people who claim to be organic. Just keep an eye on those ingredients. Keep an eye on that. Does that help? And young people I think that we automatically assume that young people know how to take care of themselves on their period. We also just have to make sure they know how to properly dispose of pads or tampons, because I've been in too many bathrooms where I see people just leave them out, or they don't know how to properly dispose of them. So we just have to make sure that young people kind of know how to care for themselves and how to properly dispose of those things as well, because I think that's an issue too. It's okay. It's okay to look. It's okay to touch the body, because there are people who they think that something is wrong and I think it also goes back to our education. It's like, we're not supposed to do that. We're not supposed to look down there, touch down there. But I think that we can. And I just want to say that it's also important for us to learn and know what's normal for us, because there are some providers, and this is something that recently came up even in our nursing program, is a lot of the textbooks don't show Black and brown skin. So providers, sometimes they don't know what's normal and what's not. And things that are normal for us, the color of our skin. And I'll give you an example. I had a young lady come in, and she, and she had, I can't remember, she ended up having yeast, to make a long story short. But, she was told that it wasn't yeast. But when I even looked at her skin, the way our skin discolors is different too. Not all of our skin turns pink. And we learned that if you're pink or, you're red or swollen, that could be yeast. But her skin was, instead of lighting, it was darker. And I was like, it looks like you have yeast. And she was like, well, somebody told me it's not yeast. But I looked at her skin, and it turned out for her that she it was during the summer in an apartment that she didn't have AC. So she was sweating a lot. But anyways, able to give her some cream to use. She came back to see me in a few weeks and it was gone. She was fine. And she said, I realized how many people looked at my skin and didn't say that there was anything wrong. So anyways, it's important for us to learn our bodies so that we do know that this is discolored, this is something wrong. Because sometimes your provider may not notice it. But just to even say what you're saying, that some people don't even know that, like the urine and the vaginal blood during the period come out of two different openings. There's still people who don't know that. But I think it's important for us to know and learn our bodies, and of course to get accurate information. And I have to touch on this really quickly because this is something also that happens, is women who get bumps from shaving, who get hair bumps. We call it folliculitis. And that's something very common in Black communities. And I had a patient that was told that it was herpes. And I was like, this is not herpes, because she was like, I keep getting it. And I examined her, I did cultures, and it was negative. And it was, because sometimes it fills up with pus. And gently, not to be too gross, but gently squeeze the pus out so that she could see. But her provider told her that was herpes, and it wasn't herpes, and didn't even test her. But anyways, I just shared that we have to learn our bodies, because unfortunately, sometimes we have to educate people, and we shouldn't have to, but that's our reality when we go in for healthcare. But if you know your body and you know something is wrong, and somebody is like, oh, that's normal, but for you, you're like, no, this is not normal for me. You advocate better when you know that. So I tell people, like you said, to look at it, take a mirror, look, touch it, even after you shave, look again so that you could see what's there. You don't have to touch just to do an exam. You touch also for pleasure too. There's nothing wrong with that. You to explore your own body. But I like what you were saying is true, is that we do have to know our body so that we know right away when something is different or something is going on. So that's key. That's key. That's extremely, extremely important. So thank you. Thank you for bringing that up. So I'm going to wrap up. Again, I just want to see, though, if there's any questions or any comments. But just to wrap up, and still know that if you have any questions, you could still reach out to me. You could go to the website, Lucinda's House. During the summer, I'm going to build up the section that is on women's health, because I've been getting a lot of questions about that, a lot of questions about pap smears, GYN exams, when you should go. And so I'm going to have more information on that. But still, if you have questions, you can always reach out to me. That's no, just keep in mind that, there's no question that's too small or too big. And I think that there's so much information that, and this was brought up very early, Lene, you brought this up about how we're not educated about certain things. But I feel the more we're educated, the more we can protect ourselves and care for ourselves. So that's one of the kind of missions of Lucinda's House, is to make sure that we can have, open and honest conversations about things that are happening with our bodies. So I'm going to wrap up unless anyone has any last minute words or anything they would like to say. And I'll have, again, if there's a topic too that you want to talk about, please let me know, and we could set up a kitchen table. Okay, thank you all for coming.